Hi, I am Linda, the creator of information about arthritis. If you are new to this channel, don't forget to subscribe. Just click the button below and then click the notification bell to receive notification of new videos when they are released. Ulcerative colitis and Crohn's disease are jointly known as an inflammatory disease of the bowel or irritable bowel disorder. They are categorized as a chronic condition that attacks your digestive tract. Arthritis, on the other hand, refers to inflammation and stiffness of the joints. There is a well-established connection between irritable bowel disorders and arthritis, particularly rheumatoid arthritis. Rheumatoid arthritis symptoms are considered to be a chronic inflammation that affects the joints and the immune system. It primarily affects the synovium, which is the lining of the joints, leading to pain, stiffness, swelling, and progressive joint damage. Rheumatoid arthritis can affect multiple joints equally throughout the body, and is often accompanied by systemic symptoms such as fatigue, fever, and weight loss. The exact cause of this disease remains unknown, but it is believed to involve a combination of genetic and environmental triggers and the immune system. An overview of irritable bowel syndrome and irritable bowel disorder, Crohn's disease, and ulcerative colitis. All involve chronic inflammation of the digestive tract, causing symptoms such as abdominal pain, diarrhea, rectal bleeding, weight loss, and fatigue. Crohn's disease can affect any part of the gastrointestinal tract, while ulcerative colitis is limited to the colon and rectum. The exact causes of irritable bowel disorder are complex and involve a combination of genetic, environmental, and immune system factors. The connection between irritable bowel disorder and arthritis is complex, with the same underlying mechanisms and risk factors. Both irritable bowel disorder and certain forms of arthritis, particularly rheumatoid arthritis, involve an abnormal immune response. In rheumatoid arthritis, the immune system mistakenly attacks the synovium, leading to joint inflammation. As for irritable bowel disorder, the immune system mistakenly triggers inflammation in the intestinal lining. The shared immune system dysfunction suggests a common underlying mechanism between these conditions. The second link is genetic factors that play a significant role in developing both diseases. Specific genes associated with the immune system and inflammation have been identified as risk factors for both conditions. Individuals with a family history of rheumatoid arthritis or irritable bowel disorder may be more vulnerable to developing the other. The third link is environmental factors, such as infections, smoking, and stress. They have been found to trigger or contribute to the development and progression. These factors can interact with genetic tendencies and influence the course of the diseases, leading to the development or worsening of symptoms. Effectively managing both rheumatoid arthritis and bowel disorders requires a full approach that addresses the specific needs of each condition. The treatment strategies may include: 1. Medication. Rheumatoid arthritis is typically managed with disease-modifying antirheumatic drugs, nonsteroidal anti-inflammatory drugs, and biological therapies. Similarly, irritable bowel disorder may require medications, such as anti-inflammatory drugs, immunosuppressants, and biological therapies to reduce inflammation and maintain remission. 2 is maintaining a healthy lifestyle, which is crucial for managing both conditions. Regular exercise, a balanced diet, stress management techniques, and adequate sleep can help improve symptoms and overall well-being. 3 is working together with healthcare professionals, including rheumatologists, gastroenterologists, physical therapists, and dietitians. This is essential in developing a personalized treatment plan that addresses the unique needs of each person. And 4 is going to support groups, people with knowledge about their conditions and providing emotional support. Can significantly improve their ability to manage both rheumatoid arthritis and bowel disorders. It would be a great help if you looked for local support groups and counseling services near you. Peripheral arthritis is the most common type of arthritis associated with irritable bowel disorder. It primarily affects the joints of the extremities, such as the hands, wrists, knees, and ankles. Peripheral arthritis typically occurs during irritable bowel disorder flare-ups and tends to be a similar activity of bowel symptoms. The second one is axial arthritis, which affects the spine, sacroiliac joints, and other areas of the axial skeleton. It is more commonly associated with Crohn's disease than ulcerative colitis. Axial arthritis can cause back pain, stiffness, and limited mobility. The third is rheumatoid arthritis, which is an autoimmune condition that has joint inflammation and can coexist with irritable bowel disorder, particularly Crohn's disease. The presence of rheumatoid arthritis in individuals with irritable bowel disorder may complicate treatment strategies. Also, require a complete approach to manage both conditions effectively. Crohn's disease and ulcerative colitis are chronic inflammatory bowel diseases that significantly impact the lives of millions of individuals worldwide. While they share certain similarities, they also have distinct characteristics that set them apart. Crohn's disease is a chronic, relapsing condition that mainly affects the gastrointestinal tract, but it can also manifest in other parts of the body. It is measured by inflammation and ulcers that can occur anywhere along the digestive system, from the mouth to the anus. The most affected areas include the small intestine and the beginning of the large intestine. Common symptoms of Crohn's disease include abdominal pain, diarrhea, rectal bleeding, weight loss, fatigue, and a reduced appetite. In severe cases, complications such as narrowing of the intestines, fistulas or abnormal connections between organs, and abscesses or collections of pus can develop. The symptoms of Crohn's disease can range from mild to severe, and they tend to occur in episodes or flare-ups. The exact cause of Crohn's disease is still unknown, but it is believed to result from an abnormal immune response in genetically susceptible individuals. Environmental factors, such as diet, stress, and smoking, may also trigger or aggravate the disease. Researchers are actively studying the interplay between genetics, the immune system, and environmental factors to understand the causes of Crohn's disease better. Diagnosing Crohn's disease involves a combination of medical history, physical examinations, laboratory tests, endoscopy and imaging scans, and sometimes biopsies. Once diagnosed, the treatment aims to alleviate symptoms, induce remission, and reduce inflammation to prevent future flare-ups. Medications such as anti-inflammatory drugs, immunosuppressants, and biological therapies are commonly prescribed. In some cases, surgery may be necessary to remove damaged sections of the intestines or complications. Ulcerative colitis is another chronic inflammatory bowel disease that primarily affects the colon and rectum, where the inflammation occurs only in the innermost lining of the affected areas. The symptoms of ulcerative colitis can vary in severity and may include abdominal pain, bloody diarrhea, and rectal bleeding. Also, the urgency to have a bowel movement, weight loss, fatigue, and loss of appetite. In some cases, complications could occur like severe bleeding, perforation of the colon, or the development of a condition called toxic megacolon, which is life-threatening as it can cause enlargement of the colon. The exact cause of Crohn's disease, which is similar to ulcerative colitis, is unknown. It is a combination of genetics and environmental factors. The immune system mistakenly triggers inflammation in the colon, leading to the symptoms of the disease. The diagnosis of ulcerative colitis involves an evaluation, including medical history, physical examination, laboratory tests, and colonoscopy with biopsies. Treatment options for ulcerative colitis aim to reduce inflammation, control symptoms, and increase remission. Medications such as aminosalicylates, corticosteroids, immunomodulators, and biological therapies are commonly used. Living with Crohn's disease or ulcerative colitis, or any type of arthritis, can be physically, emotionally, and socially challenging. Individuals may experience chronic pain, unpredictable symptoms, dietary restrictions, fatigue, and reduced quality of life. Coping strategies often include a healthcare team comprising of gastroenterologists, dietitians, mental health professionals, and support groups. Educating oneself about the condition, maintaining a balanced lifestyle, seeking emotional support, and adhering to prescribed treatments are essential. Irritable bowel syndrome presents a wide range of symptoms, which can vary from person to person. The most common symptoms include abdominal pain or discomfort, often relieved by bowel movements and changes in bowel habits. These changes may manifest as diarrhea, constipation, or a fluctuation between the two. It is important to note that irritable bowel syndrome symptoms do not cause structural damage to the intestines. While the exact cause of irritable bowel syndrome remains unknown, several factors have been identified as contributors to the aggravation of the symptom. These factors can include certain foods or beverages, stress, hormonal changes, and bacterial imbalances in the gut. Common dietary triggers include fatty or fried foods, spicy foods, caffeine, alcohol, and artificial sweeteners. Stress and emotional factors, such as anxiety and depression, can also play a role in triggering or worsening symptoms for some individuals. Diagnosing irritable bowel syndrome can be challenging, as there are no specific diagnostic tests. Physicians typically rely on the Rome criteria, a set of guidelines that help determine the presence of irritable bowel syndrome, which is based on symptom duration, frequency, and consistency. It is crucial to undergo a comprehensive evaluation, including medical history, physical examination, and specific tests, to rule out other potential conditions with similar symptoms. While there is no cure for irritable bowel syndrome, management strategies aim to alleviate symptoms and improve overall well-being. Lifestyle modifications, dietary changes, stress management techniques, and medications are commonly utilized to manage irritable bowel syndrome effectively. It would help if you did regular exercise, adequate sleep, and a routine can help regulate bowel movements and reduce stress levels. It also is crucial if you identify and avoid trigger foods. Keeping a food diary and working with a healthcare professional, such as a registered dietitian, can help determine specific dietary triggers. Some individuals may benefit from a low FODMAP diet, or another name is gluten-free foods, which restricts certain types of carbohydrates known to cause digestive symptoms. Meditation, deep breathing exercises, and engaging in hobbies or activities that promote relaxation can help alleviate symptoms. Over-the-counter medication is an option, such as antispasmodics, fiber supplements, and laxatives may provide temporary relief. But always consult with your doctor if you want to start on over-the-counter medication or any supplements. Prescription medications may be recommended for more severe symptoms. Individuals with irritable bowel syndrome often experience emotional distress due to the impact of the condition on their daily lives. In conclusion, the interconnections between irritable bowel syndrome, irritable bowel disorder, and arthritis highlight the complex nature of these chronic conditions. While they affect different parts of the body, there are significant overlaps in terms of symptoms, underlying mechanisms, and risk factors. Managing irritable bowel syndrome, irritable bowel disorder, and arthritis needs a complete approach. Healthcare professionals, including gastroenterologists, rheumatologists, and other specialists, are crucial in diagnosis, treatment, and ongoing management. Lifestyle modifications, including diet, exercise, stress management, and adequate sleep. Understanding the nature of these conditions, recognizing triggers, and adopting appropriate coping strategies empower individuals to take an active role in their own care. Support groups and counseling services provide valuable emotional support and a platform for sharing experiences and knowledge. Continued research is needed to develop our understanding of the underlying mechanisms and to explore new treatment options for these interconnected conditions. Overall, with proper management, support, and a proactive approach, individuals can navigate the challenges presented by these diseases, leading fulfilling lives and minimizing the impact of these chronic conditions on their daily activities. I am not a medical professional, and the information in this video is for information only. Always consult your doctor if you have any worries. I hope this has helped you and good luck. Linda.